Hello! Welcome to part 1 of Lune and IHI's collaborative video series about menstruation. Today, we will be covering menstrual health, specifically the menstrual cycle, common misconceptions, and tips for how to maintain proper hygiene and health. For more information, check out our next video about menopause and resources in your local community. Menstruation, also known as a period, is a normal bodily process where the body prepares for pregnancy by producing hormones that make the uterus lining thicker every month. If no pregnancy occurs, the uterus sheds its lining. Menstruation usually begins every 21 to 35 days and typically lasts anywhere from 2 to 7 days. When somebody first starts menstruating, their cycle may be irregular, meaning that menstruation is less consistent and can happen more or less frequently. Most people that menstruate get their first period in between the ages of 10 to 15. Though the average age is 12, everybody has their own schedule. Quick review. A period occurs every 21 to 35 days, typically lasts anywhere from 2 to 7 days, is a normal bodily process that occurs as a part of an individual's monthly cycle, or all of the above. If you chose all of the above, you are correct. A quick menstrual anatomy overview. The ovaries are two small oval-shaped organs located in the pelvis. The uterus, also known as the womb, is a muscular organ that is located between the bladder and the rectum. Once an egg exits the ovaries, it implements itself in the lining of the uterus. Premenstrual syndrome, or most commonly referred to as PMS, is a series of changes many people experience 1 to 2 weeks before starting their period each month. These can be physical, emotional, or behavioral changes and are completely normal. Physical symptoms include, but are not limited to, acne, bloating, feeling tired, backache, breast soreness, constipation, food craving, headaches, and diarrhea. Emotional and behavioral changes include, but are not limited to, depression, moodiness, difficulty focusing, trouble handling stress, and difficulty sleeping. Disclaimer: not everyone experiences all of these symptoms, and they usually disappear once your period begins. Menstrual cramps. Menstrual cramps may start 1 to 2 days before your period or at the time when bleeding begins, and can last anywhere between 2 to 4 days. Cramps are a result of uterus contractions as your uterus tightens and loosens to release and shed its lining. These contractions can cause jabbing pain in the lower abdomen or back regions, and some symptoms include an upset stomach, vomiting, or even passing out. Pain management. Pain relievers such as aspirin and ibuprofen can alleviate mild menstrual cramps. Heat compression, warm baths, drinking water, acupuncture, massages, herbal medicines, exercise, and avoiding heavy consumption of caffeine and salt are just some ways to help with the discomfort and pain. Birth control pills are also an effective way to alleviate menstrual cramps and the symptoms accompanied by them. If you have severe or unusual menstrual cramps or cramping that lasts more than 2 to 3 days and/or is different from your normal cycle, please contact your doctor for follow-up. Everybody's cycle is different, and while some people may experience severe menstrual cramps, others may not experience any. Both are completely normal and a part of menstruation. It's always good to talk with your doctor before taking new medication or if you have any questions about your period. Feel free to bring your questions and concerns to a physician you trust. Quick review. True or false? Pain relievers such as ibuprofen and birth control pills can alleviate symptoms and menstrual cramps. If you said true, you are correct. Pain relievers can be an effective pain management tool, but make sure to consult your doctor to figure out what works best for you. Did you know? There are many common misconceptions about menstruation, but it is important to know the difference between myths and facts. Periods are a completely natural and normal bodily process. It does not indicate impurity or uncleanliness. Menstrual blood is actually regular blood, even though it flows from the vagina. Vaginas are a completely normal part of the human anatomy, and so there is nothing unusual or wrong about menstrual blood. The myth that you should not shower, take a bath, or wash your hair has been debunked. There is no reason to change your daily hygiene habits during your menstrual cycle, and a warm bath or shower can often help with cramps. It is crucial to maintain good personal hygiene during your period to avoid health complications. It is a common misconception that irregular periods are detrimental to reproductive health. However, irregular periods are very common, especially during the first year of your period. For some menstruators, the menstrual cycle never becomes completely regular. Stress, illness, along with many other factors can affect the length and the flow of your period. Contrary to popular belief, tampons can be used at any age and should not be painful if inserted correctly. It is important to read and follow the instructions and warnings to minimize pain and discomfort. There is a widespread misconception that it is not possible to get pregnant during menstruation. Although you are unlikely to get pregnant while you have your period, there is still a chance that you can conceive during this time of the month. Quick review. Which of these is a myth? Irregular periods are very common and completely normal. Menstrual blood is regular blood. Periods indicate impurity and uncleanliness. You can still get pregnant during menstruation. If you said C, you are correct. The myth that periods indicate impurity and uncleanliness has been debunked. Periods are a completely normal way of life, and there is nothing wrong with menstruation. Menstrual products. What are the most common menstrual products? A pad is the most common menstrual product, and it is worn by attaching it inside the underwear. It is important to change each pad every 4 to 6 hours to maintain vaginal hygiene and avoid rashes, irritation, or urinary tract infections. Pads can be used for almost every activity and come in a range of sizes for different days and flows of your period. Pads are made of various materials, from cloth to cotton, and are either disposable or reusable. Disposable pads, as depicted on the right, are more convenient for the majority of menstruators because they are more accessible and there is a lower upfront cost. They are usually made of cotton and synthetic fibers and come in various different types and sizes, ranging from panty liners to overnight pads. Reusable pads, as depicted on the left, are typically better for the environment, less irritable, and can often be more affordable than disposable pads. However, reusable pads need to be washed and dried properly after each use. It is ultimately one's individual preference when it comes to choosing the right menstrual product for you. Tampons are placed internally inside the vaginal canal during menstruation, and they come in different sizes from light to ultra to match the flow of your period, allowing for smooth removal and ultimate protection. All vaginas are different, so depending on anatomical differences and conditions, tampons may not work for everyone. The right menstrual product and experience can vary for each menstruator. Tampons should be changed every 4 to 8 hours to avoid health complications such as toxic shock syndrome. While toxic shock syndrome is rare, one must make sure to avoid wearing more absorbent tampons than necessary for longer than recommended. Symptoms of toxic shock syndrome include but are not limited to a sudden fever of 102 degrees or more, vomiting, diarrhea, fainting, dizziness, or a rash that looks like a sunburn. If you see any of these symptoms over the course of your period, remove the tampon and seek medical attention immediately. Quick review. What is one way to avoid toxic shock syndrome? Avoid wearing a tampon for longer than recommended. Use the highest possible absorbency tampon for your flow. Use tampons for longer than the recommended time, 4 to 8 hours. None of the above. If you said A, you are correct. While toxic shock syndrome is rare, one must make sure to avoid wearing more absorbent tampons than necessary for longer than recommended. Lastly, we are going to talk about menstrual cups. A menstrual cup is another reusable menstrual product made of rubber or silicone. Once inserted in your vagina, a menstrual cup collects menstrual blood and can typically hold more blood than other methods. Many menstruators use this option as an eco-friendly alternative to tampons, and depending on your flow, a menstrual cup can be worn for up to 12 hours. Thank you so much for watching the first video in our 2-part video series about menstruation. Check out our next video for more information on menopause and resources in your local community. Please take our short survey in the description below for a chance to win a $20 gift card and subscribe to our newsletter for additional resources. Lune, here for you, period. IHI, empowering our communities by empowering you.